Howdy! Welcome to the Texas A&M University College of Veterinary Medicine and Biomedical Sciences Peer Program's STEM Education Series. Today, Dr. Mark Stickney from the Small Animal Teaching Hospital will present Modern Careers in Veterinary Medicine. When exploring the career options within the field of veterinary science, dogs and cats don't even scratch the surface. Dr. Stickney will describe the many roles of veterinarians within private practice, academia, research, and government, as well as highlight those roles of career options that support the veterinarian, including a veterinary technician, animal caretakers, or animal behaviorists and trainers. Welcome, Dr. Stickney.
Hello there. It is great to be here this morning to speak with you guys about what I think is a fantastic career and a wonderful way to take care of animals and people throughout your life, and that is being a veterinarian. I am one of the veterinarians at the teaching hospital at Texas A&M University. I work in the small animal hospital, and there I teach surgery to veterinary students that will soon be out in the world performing surgery on patients that belong to people and making sure that they have optimal care. So let's talk about being a veterinarian and what that entails and how you get there. There are currently 30 veterinary schools within the United States of America. Veterinary medicine program is a 4-year program that you enter after performing 2 or 4 years of undergraduate training first, and then applying to veterinary school and being accepted into the program. At Texas A&M University, we have over 500 people apply for 136 spots each year. So it's a very competitive field to enter. If you look at all of the veterinarians in the United States of America, there are 102,583 veterinarians. And that sounds like a lot, but if you took all of those veterinarians and put them inside of Kyle Field, our football stadium, they would all fit inside of there and there would still be seats left over. So there really are not that many when you look at the entire population of the United States and all of the places that need veterinarians to take care of animals. What do veterinarians do? Generally speaking, a veterinarian's job is to care for pets by preventing disease in the first place. When an animal does have a problem, doing appropriate testing and physical exam to diagnose that disease. And then finally, when we have a diagnosis, treating that disease in the best way possible for the animal to either be cured of that disease or manage that disease so it is still a happy pet at home. Traditionally, the veterinarian that we think about is the other family doctor, where you take your pet to the veterinary clinic. You may take it there to have its yearly wellness exam and receive whatever vaccines it needs, get flea preventative, have your animal tested for heartworm disease and be treated for that, or also bring your pet there for any problems they may have. Dental cleanings are an issue with pets, just like they are with people, and that's another reason that we would take our animals to the veterinarian, and we recommend having your pet's teeth cleaned twice a year by your veterinarian. So there is the basic taking care of our pets just like we do for ourselves when we go see the doctor, but there is so much more that veterinarians can do besides that. And the career options are really endless, and anything that you might be interested in doing that involve the animal field, there's an opportunity for you to do. The modern veterinarian has so many different career options besides simply going into a practice and taking care of animals. And that is a wonderful thing to do. But if there is something else that is really exciting to you, you'll have an opportunity to do that as a veterinarian. Overall, the focus of what you will do still revolves around prevention of disease, diagnosis, and treatment of disease. It may just differ in the way that you deliver that level of care to your patients. There are small animal hospitals and large animal hospitals. So if you wanted to be a mixed animal veterinarian, you could take care of everything: dogs, cats, horses, cows, sheep, goats, anything that came to your hospital, you could take care of. But let's say that you really like dogs and cats and weren't a big horse person. You could go to work in a small animal hospital. On the other hand, let's say that cats are not really your thing and you really want to work on horses or only want to work on cattle. You could go to a large animal hospital. Exotic animal medicine is a very exciting and very interesting career option. There are some basic things that we know about exotic animals, but there's a lot of things that we don't. So it's really one of the cutting edges of veterinary medicine, and it gives you an opportunity to really try some new and interesting things on pets that people have at home that are not your traditional dog or cat or horse. Laboratory animal medicine involves taking care of animals in the research setting. All of the animals that are involved in the research for new medicine or new surgical techniques, all of them need a veterinarian to look after them and advocate for them to make sure that during whatever procedure is going on, they are happy and stress-free and pain-free. A lab animal veterinarian would do those things. Research is another area where it is critical to have veterinarians. There are so many different diseases that we are just now beginning to get a really good understanding of. And we gain that understanding from veterinarians who are interested in researching specific problems with those animals and looking at specific treatments that would be able to help them. Zoo medicine is not for the faint of heart. It is a field of veterinary medicine where you will be working on very large zoo animals. So this differs from exotic animal medicine when we have an animal that is a tame pet in somebody's home, like a guinea pig or a lizard. Now we are working with what is actually a large wild animal, like a tiger or a lion or an elephant or a zebra. Animals that do not want to have anything to do with a human. So these require, being a zoo animal medicine veterinarian requires having excellent observational skills so that you can watch the animal from afar and start to get an idea of what the problem is. And then you have to know how to safely handle different drugs that you will use generally to use a dart gun to anesthetize the animal so that you can actually get your hands on it to do things. They won't come up and sit nicely for you to do a physical exam. All of these animals have to be anesthetized before you can ever do anything with them. And they usually require very specialized equipment or equipment that you are going to have to create on your own in order to do procedures with them because they are so large. The lion that you can see in the photo there is about 500 pounds, and that is a lot of animal to do any kind of surgery or medical procedure on. Wildlife medicine veterinarians generally look at animal populations and how those populations and the environment around them interplay with each other. Here we see some wildlife veterinarians who are working with a bear, and that bear has been anesthetized so that they can do whatever they're going to do. A lot of it involves tracking these animals, placing radio collars on them, or taking blood samples in the field to look for different diseases or to determine what normal blood values would be for those animals. We then see another veterinarian releasing a large tropical bat to go and back into the environment and do what it normally does, but he has performed whatever procedure or whatever radio tracking he needs to do on that animal in the first place. So those are all options. Other things that you could do as a veterinarian would be to specialize in one specific type of animal. So you could say, I really like cats, and I've loved cats my entire life, and that's all that I am really interested in doing. You could go into a cat-only practice, where the entire practice is designed around making cats happy and stress-free when they come to a veterinarian. You could say, I really like pigs. I want to be a swine veterinarian. That is just something that's really exciting to me. And you would go and work as a swine veterinarian for industry or in the private sector for taking care of herds of swine. Poultry veterinarians are another specialization of single animal veterinarians. You could also enter the educational setting, which is what I did, where you teach the veterinarians of the future what they need to know in order to be successful in whatever career option they choose as a veterinarian. And educating veterinary students is a lot of fun, and it has a lot of challenges. We have a whole lot of information we have to teach them in a very short period of time. We only have our students for 4 years in the veterinary curriculum, and during that time, we have to teach them not to treat one species, but to treat all of them. Every veterinarian has to graduate knowing enough about dogs, cats, cattle, horses, swine, and any other exotic animal or any other type of animal to be able to practice on that animal competently when they graduate and go into practice. So a couple of things that we use when we are working with our animals is we look at a lot of different models, and these help us to teach our students what they're looking at. And here I have a model of a dog mouth and a cat mouth. And what you're able to see are the normal teeth in these animals. And each animal has its own individual dental formula. That means that every animal has a unique number of incisors, canines, premolars, and molars. And you have to be able to know which teeth belong where when you're performing a dental exam and a dental cleaning so that you can recognize if there is a tooth that is missing or a tooth that never erupted, or if they have retained baby teeth. Just like with us, when we lose our teeth as children and we get our adult teeth, dogs, cats, and other animals all do the same thing. So you need to know what is normal by looking at these models and by looking at normal, healthy animals in order to recognize what is abnormal when you see it. One of the things that we need to be able to do as veterinarians is to perform surgery. And that can be a scary thing the very first time you have to do that on someone's pet poodle. We do a lot of different training techniques with our students to make them competent surgeons. And one of the first things that they start with is with a knot tying board. If you're going to do surgery and make an incision in an animal and then close that incision, you have to be able to tie a knot that will not untie and create a problem for the animal later. So one of the first things that we do is start with a knot tying board, and we start with just a piece of string, and the students have to learn how to tie a square knot and different types of suture patterns before they're ever allowed to work on any type of a more advanced model or an animal to practice with.
Dr. Stickney, we
Yes.
have some questions for you if
Wonderful.
you'd like to take a break here.
I will take a break.
They are very interested in the wildlife and zoo animals. So the first question is, it deals with that and just other areas outside private practice. They'd like to know, is there specialized training required to work as a vet outside of a private practice? So we'll start there and then have a couple others.
Yes, so we're actually going to get to that in a few moments, but there are a number of veterinary specializations. So if I want to become a specialist and work with, and be at the top of my field and work with some of these really unique animals, for example, let's take zoo animals. There is a specialization that is called the American Board of Zoo Animal Veterinarians. And after veterinary school, you would do 3 to 4 more years of specialized training where you would only work on those types of animals. And after you completed that extra training, then you have to study for an incredibly difficult exam called a board exam. You take this test, and if you pass the test, then you are certified as a specialist in that area. So if I wanted to become a zoo animal veterinarian, I would do 2 to 4 years of undergraduate study. I would do 4 years of vet school, so that is 6 to 8 years of school already. Then I would do a rotating internship, so a year of specialty training in a hospital. So that adds us up now to potentially 9 years. Then I would probably do another specialty internship in only zoo animals. And then I would do a 3-year residency after that. So in order to become specialized in that area, we are looking at about 12 to 14 more years of school after we graduated from high school in order to become that type of a specialist.
And would that be true also for, they would like to know about marine mammals, say you wanted to work at SeaWorld or somewhere like that?
Yes, so you would have to do a similar thing with working with those types of animals. The Veterinarians that work for places like SeaWorld are specialists in those areas. Those animals are so rare and so expensive that they have to have the very best people that would work on them. The important thing to do if you want to work in those areas is to start very early in your career making contacts with the veterinarians and the staff at those places so that you can take advantage of different summer internship programs they have at areas like that, so that you can make your face and your name recognized and let them know that you're interested in ending up there at some point, and staying in touch with those people early on.
Okay, and then one more before we get back to the presentation.
Sure.
They would like to know, and again with the zoo and wildlife, what's
Yes.
the biggest animal you have worked on? And in general, how dangerous is it to work on maybe the one you worked on, or animals, wildlife and zoo animals in general?
All right, so the biggest animal that I ever worked on was last Christmas Eve. It was a 450-pound lion that had a uterine infection. So the uterus is where baby lions grow, and she had an infection, and we had to basically spay the lion. So we had to have our board-certified anesthesiologists. So those are veterinarians that have decided they love anesthesia, and that's all they did. And they did all of that specialty training to be an anesthesiologist. So they showed up first, and they found the best combination of sedatives and drugs to give the lion to anesthetize it so that it would not be a danger to anybody. And that all began first by tricking the lion into eating a little piece of food, a little snack that had some drugs in there that would make her very sleepy. And then after that, we were able to give her an injection to make her anesthetized. We placed an IV catheter in her to give her fluids so that we could maintain her blood pressure under anesthesia. And then we intubated her, which means that we took a tube and we placed it into her trachea, through her mouth into her trachea, and connected her to an anesthetic machine that was giving her oxygen and anesthetic gas to keep her asleep the entire time. So we had to use our very biggest operating tables and gurneys to move this lion around, and it was about an 8-person job to shift the lion from the gurney onto the operating table. Our operating table can only handle 500 pounds of animals, so she was right at the cusp. If she had been 50 pounds heavier, our table couldn't have handled her. And we did the procedure using just about the biggest suture that they make. And I had to have 3 assistants help me with that procedure because she is such a large, thick animal. All of her muscles in her abdomen were so thick and so strong that I had to have 3 people actually holding her belly open for me so that I could perform the procedure. And after surgery, we closed our incisions. We took her back to. She came to us in a big, like a circus cage, basically. That's how they transported her to us. And we put her back in there to wake up. And after about an hour, she was awake and pain-free and kind of sleepy, but doing really, really well. And then it was time to go enjoy Christmas Eve.
All right, I think we're ready to move on.
Okay, great. So one of the other things that we use for teaching this is an example of another model, and this is called the DAISY model. And the way that this is made is that you can cut different incisions in it, and there's basically 3 layers that are in here. So you can practice closing the skin layer, you can practice closing the sub-Q layer, and then you can practice closing the muscular layer of the model. And this particular model is also made so that you can pretend that you have the animal's intestines, and we can take these out and we can practice making an incision in the intestines and closing that up. Let's see, I've got another end of an intestine in here somewhere. There we are. So here we've got, why would you ever do this surgery? This is when dogs especially eat something they're not supposed to eat, like a tennis ball or some other type of a toy or a gigantic bone, and it gets stuck in their intestinal tract. So what we do with this model is this allows us to practice doing the surgery where we would have to open up their intestines and remove the object. So this is something else to practice on, and this is a very technical surgery because once I have made an incision in my intestines, I've always got digestive fluid and partially digested food going through my intestines. If I don't close this correctly, I'll get a leak, and then I've got stomach acid and things that don't belong in my abdomen floating around in there, and that can get you really, really sick and be a reason that an animal would die. So you've really got to know how to do this procedure. So this is a model that we use to train for that. Food safety is another area where veterinarians work, and I think this is an often overlooked area. All of the food that we eat has to be inspected by veterinarians. All of the meat, all of the dairy, we have to make sure that it is maintained at the proper temperature and handled properly so that people don't get sick. Every now and then you'll hear in the news about someone who got salmonella or listeria, different bacterial infections from food that wasn't handled well. It is the job of a food safety veterinarian to prevent that from happening. Disaster and emergency responsiveness has become a big area of veterinary medicine in the past 15 years. So whenever there is a disaster like a hurricane that hits the coast and causes a lot of damage and destruction, there are organizations that take care of the people in those areas, and then there are also veterinary organizations that go in and take care of the animals as well. Veterinarians are necessary for animal shelters and for rescue organizations. Millions of animals every year end up in animal shelters, and the animal shelter veterinarian is responsible for maintaining the health of those animals and for doing the things that are necessary to prevent a disease outbreak in the shelter where we have a lot of animals very close together. We want to make sure that they are healthy so that they are able to be adopted. So like I was mentioning before, there are lots of different specialties you can go into. If you want to go into practice and be a veterinarian, that's fantastic. But if you say, you know, I really, really, really like surgery and I want to be a surgical specialist, there is an opportunity to do that. There are 40 different veterinary specialties that you can enter. And there are more than 11,000 board-certified veterinarians in the country. When you look back at the number of there being about 103,000 veterinarians total, that means that about 12% of the entire veterinary population is made up of specialists. Like we were talking about before, after you complete 4 years of veterinary school, then you'll need to do a year of internship, 2 to 3 years of a residency, and then pass a very difficult little celebration of knowledge, a little board exam test that requires about 3 months usually of doing nothing but studying 8 to 10 hours per day to get ready for it. Areas that we could specialize, a couple of those would be anesthesia, which we have already mentioned, surgery, zoo medicine, equine. You can become a board-certified clinical practitioner where you just stay on the cutting edge of everything that's coming along in veterinary medicine, so you can always offer your clients the newest and best treatments for pets. There is emergency and critical care as a specialist. Dentistry is its own specialty. So there are a lot of different specializations that we can enter into. And really, if it is something you are interested in, there is an opportunity for you to progress further in your knowledge in that area. So preventing disease and treating disease is really what it all comes down to with veterinarians. And when we prevent disease, we are also preventing disease not only in animals, but also in people. There are a lot of diseases that are spread by animals that can infect people, and there are a few that are spread by people that can infect animals as well. One of the big areas of disease prevention involves insects and parasites. And this is a model of a tick. So ticks are thankfully not this big. They are much, much smaller than this, but they are little arachnids that you can run into when you're outside, and they can spread things like Rocky Mountain spotted fever and Lyme disease. Those are diseases that affect both humans and animals. We also are all aware of the problem with fleas. Fleas can spread disease to our pets, and once they get on our pets and into our home, they can bite us, and that is not any fun. And then mosquitoes are responsible for millions of deaths in people each year because of the diseases they spread. One of the most common diseases they spread in animals is a disease called heartworm disease, where the mosquito injects tiny little worms into the dog, and those parasitic worms go to the dog's heart, where they plug up the heart valves and the heart vasculature, and those animals will eventually develop heart failure and die if you don't give them prevention or if you don't treat that disease in them. Working in academia is an area where you get to do research, train the future veterinarians of the world, and educate the public on issues with their animals. And then private industry is another area where you can enter, where you are looking at the safety of products or preventing animal diseases like mad cow disease by looking at different issues that are affecting the public at the moment and how to prevent those from being a problem any further and eliminating them. Government agencies like the CDC and the FDA and the USDA are all responsible for maintaining food safety and safety of the public by making sure that animals are healthy and safe. The military is an area where veterinarians are needed to take care of military working dogs and horses and the pets that belong to the family members of the military. Volunteering to help as a veterinarian is an important thing to be able to do. There are numerous countries where veterinary care is nowhere near the level that we have here in the United States of America. And there are veterinarians that volunteer their time and services in underserved areas and underserved countries to help take care of animals that are there, and to help, by taking care of the animals, help the care of people. And here we see some veterinarians and veterinary students that volunteered on a trip to go to Mexico, where they vaccinated animals and did parasite control on those animals. Parasites from animals can often spread to people and cause problems, so that is a good thing to prevent. Diagnosing disease and developing new treatments for those diseases is very important. The things that we just did, that we were doing in veterinary medicine 10 years ago, have now been outpaced by new things that we are doing now. And here's a couple of things that we look at and diagnose in dogs and in cats and other animals. So what I'm holding here is the model of a knee, and this is a model of a dog's knee, but it actually looks exactly like your knee does. This is your patellar tendon, and your kneecap is in here, and this would be your femur and your tibia, and you can see that you've got your menisci here that are little shock absorbers between your two bones, and your healthy knee bends, and these shock absorbers, when you run, keep your cartilage and your bones from being damaged. And then this is a knee of a dog that has developed arthritis or some other problem with its joints, and you can see here that we have inflamed cartilage. You can see that the bone itself is inflamed, and this dog would be, and we can see that the bony surface is no longer nice and smooth. This dog has a lot of arthritis that is going to be very painful to that dog, so we would want to find a way to treat this pet so he was more comfortable, in very much the same way that we would treat that a person would be treated if they had to have knee surgery. This is the spine of a dog. And this is what a normal spine looks like. And we've got our vertebrae, the bones of your spine, and this is your spinal cord. And then these are intervertebral discs, these gray things that are between each of your vertebrae. And they're shock absorbers as well, so that when we jump up and down, we don't hurt our backs. But one of the problems that we see often in dogs, especially in dachshunds, is that this disc has jelly in it, so that it's nice and soft, and it acts as a shock absorber. Sometimes that jelly will explode out of the disc and put pressure on the spinal cord, and now we have a dog that's paralyzed. And this dog is going to require emergency surgery for us to come in and cut out this bone and remove this disc that has exploded, so that we have a chance for that dog to be able to walk again. And on this slide, you can actually see a dog, the little beagle dog there. That dog ended up being permanently paralyzed from a problem with its back. And instead of having to put that dog to sleep, to euthanize that dog, which is what we would have had to do 20 years ago, now we make little carts for them, and the wheels take the place of that dog's legs, and he can run around and do all of his regular stuff with a little cart instead of having to use his back legs. Another thing that we are able to do is we can now do total hip replacements in dogs. These used to be very, very tricky and difficult to do, and not many people do them, and now we do them very commonly. So this is the hip bone of a dog, and this is the dog's femur. And remember, you've got a ball and socket joint here at connecting your femur to your hip. When we do a total hip replacement, we take out the part of the bone that is causing the arthritis or the problem, and we replace that with a stainless steel ball joint, and we replace the socket with a nice smooth plastic socket. And then we're able to put those together, and now the dog has a non-painful joint that it can use to walk around on. So there are so many different things that you can do as a veterinarian besides the traditional route. Now, let's say that you love working with animals and you enjoy working with people, but that's just too much school and you don't want to do all of that, but you'd sure like to be able to continue to work with animals. There are so many careers that will allow you to be able to do that as well. The first one that I think about is as being a veterinary technician. I'm a veterinarian and I can do a lot of things, but when it comes to doing good nursing care on those animals and drawing blood and placing catheters, there are people that are much better at it than I am, and those are my technicians. So they get to handle those animals every day, and they get to speak with the clients about the pets and make sure that everything is going well, and that is a very rewarding career option. Being a zookeeper is something that is a very exciting thing to do. As a zookeeper, you will typically work with a certain group of animals and get to know those animals really, really well, and they will get to know you well. And it is the closest that some people will ever get to working with some of these really unique zoo animals. Being a wildlife rehabilitator gives you a chance to work with injured animals on a daily basis. So animals get hurt, they get hit by cars, they get found because they were abandoned by their mothers for some reason, and somebody finds them. They're otherwise healthy. The animal will go to the wildlife rehabilitator, and they will raise that animal or help with whatever problem it has to get it back in shape to be able to be released into the wild and function as a normal animal once it gets over whatever its problem is. There's an old saying that if you have no hoof, you have no horse. And hoof problems are very common in horses, and one of the big ways we treat those is by putting specialized horseshoes, just like you might have specialized shoes if you had a foot problem, or if you had to put your foot in a boot if you damaged your ankle. We can use specialized horseshoes to help horses get over their problems with their hooves so that they are able to go back to being a normal horse. Some people like working with dogs a lot and like being dog groomers or taking care of pets at a boarding or a dog vacation facility where you get to play with the dog every day and make sure that it's happy while its owners are away, or make sure that it's got a nice haircoat and haircut and not a lot of mats in its hair, and some people enjoy doing that. Being a pharmacist is a very important job that allows you to work, usually not directly with the animals, but with the owners of animals. There are a lot of drugs that we use that are the same drugs that are used in people, but the dosages are different. Or we need to be able to compound a drug where we take it from its normal pill state and make it into a liquid so it's easier to give to a pet. A pharmacist would do those types of things. Being a volunteer or a foster parent for an animal shelter is another rewarding area that would allow you to work with animals daily. The animals in the shelter need to be walked with and played with and trained every day so that they are clean and happy and are able to be adopted. And then sometimes animals need to move out of the shelter and get more socialization. So a foster for an animal shelter would take on a new animal, take care of it, get it ready to be adopted, return that animal to the shelter, and take on a new animal. So it's kind of a way of getting different animals every few months in your house. Some people like to be the ones that will train animals to do different things, like the animals at SeaWorld. The veterinarian cares for the health of the animal, but it's the trainer that works with those animals every day and makes them able to perform and sees them on a daily basis and can notify the veterinarian when there is a problem. Training dogs to do agility, or some animals have to be trained to be used in the movies. So animal trainers are an important and great way to work with animals on a daily basis. The animal control officer is the guy we call when there is, or girl, or that we call when there is a problem with an animal that we have discovered on the streets, or if you live down south, maybe an alligator has decided it likes your garage. You would call the animal control officer to come and get that alligator. Earlier in the spring, I had a water moccasin that decided it wanted to be in my garden, so I called the animal control officer to come and get it. The state health animal inspector makes sure that all of the animals that are about to go into the food chain for us to be able to eat are healthy and will not be at risk of giving us any sorts of diseases when we process them for food. Search and rescue handlers are people that have trained animals that are able to find people that are lost. And these animals are fantastic at going into dangerous and difficult environments with their handlers and then finding somebody that has been lost or injured and can't take care of themselves. Animal breeders are important for making sure that only animals that have good genetic lines are bred, and that we don't have animals that we know have a potential disease problem. We don't want those animals to be bred to an animal that also has that disease, because now we're going to have animals that aren't healthy when they're born. So making sure that we are breeding for good genetic stock is very, very important. Like we mentioned before, a wildlife biologist doesn't necessarily have to be a veterinarian, but they will probably work in conjunction with a veterinarian to come up with different anesthetic protocols and do physical exams on animals. And I like this quote from Steve Irwin. Steve Irwin and Jeff Corwin are probably two names that you recognize from Animal Planet and different TV shows. And Steve Irwin says that crocodiles are easy. They try to eat and kill you. People are harder because sometimes they pretend they like you first. And I just think that's a little bit funny because you always know what you're going to get with an animal in most cases. So I hope that we have touched on a lot of the amazing opportunities that you have as a veterinarian and as someone who would just want to be someone that worked with animals on a daily basis. The sky is the limit for any of those fields, and it's really only limited by how hard you want to work and what it is that you want to do. So I would be happy to answer any questions that we have now.
We have quite a few.
All right, wonderful.
The first set are going to be about you.
Okay.
And this one, you may be a bit biased, but they would like to know, what is the top veterinary school in our country?
Okay, so of course I'm biased, and I will say that there is no place better than Texas A&M University that you could ever go to. That being said, though, veterinary school is very, very expensive. So if you're in a state that has one of those 30 veterinary schools, that's the school you want to go to, because you'll be able to go there with as little expense to yourself as possible. When you look at, every year they do different surveys for veterinary schools, and depending on the survey that you look at, Texas A&M is usually in the top 3 to top 5. So it's a great place to go. We have a really unique population and group of people here that we work with, and it would be a fantastic school. But at the end of the day, any veterinary school is going to be outstanding. They all have to pass regulations by the American Veterinary Medical Association, and you really can't go wrong.
All right, so now they'd like to know your path. How'd you get to be here? How long have you been doing this? And then have you ever been bitten or contracted a disease or illness while working with animals?
All right, sure. So there's a lot tied into that question, so I'll just talk. So I graduated from veterinary school in 1997. And at that time, I wanted to be a wildlife and zoo animal veterinarian. Prior to veterinary school, I had done 4 years of undergraduate work and gotten my degree in wildlife and fishery sciences. And then I did 4 years of veterinary school. And after veterinary school, I did a 1-year internship in small animal medicine and surgery. I was going to use that as a path to further specialization with exotic animals. But as I did that year, I realized that I was actually more interested in surgery, and the exotic animals were a lot of fun, but I really liked the immediate satisfaction of being able to do surgery. And even doing surgery on exotic animals, I really enjoyed that. So I decided to change my career path a little bit at that point. I went into private practice for a year, and then I performed a 2-year residency with the American Board of Veterinary Practitioners to become an all-around general specialist in small animals, canines and felines. And that path then led me to be to work at a university as a veterinarian who took care of the primary caseload of the animals that came in, but I also did all of the exotic animal and medicine surgery there. In 2002, I came to Texas A&M, where I have been here as a surgical instructor, and this is what I've done ever since. As far as things that have happened, I have been bitten twice in my career, once by a cat and once by a dog, and in both cases, they were because my hands weren't where they were supposed to be. And then I have also gotten ringworm from a patient once and had to have that treated. But otherwise, I have managed to stay pretty healthy as far as anything that I could catch from an animal has gone.
All right, so the next question kind of goes along with that path. They'd like to know what they can get involved with, what programs are available for people of their age, around 13, to prepare them for this career.
Okay, so a few things that are very important is, number one, your grades, especially in regards to science and math. You want to be very good in those courses. You want to be an A student in those courses, because that is going to be the stepping stone that, as an undergraduate doing your classes that will prepare you for veterinary school, they're going to be very heavily based in math and science. So you want to be really good at those. So that's step one, is focusing on those areas. And then remember that veterinary medicine is very competitive. So when you are in college, it's important that you do really well in all of your classes so that you've got a great grade point average when you make your application. At your age, the other things that you want to do are work for a veterinarian. Find a veterinarian in your community that will let you do anything. You can be the kennel keeper, you can work as an assistant there, you can work in their boarding facility, anything that will allow you to work with those animals on a daily basis, have contact with a veterinarian, and get to see and do some neat things. And that way, as you progress in your career and get a little bit older, you'll take on more and more responsibilities. When it's time to apply for veterinary school, you'll have a veterinarian that you've worked with for years who will write you a fantastic letter of recommendation. So that's an important thing to do. It's also important to be involved in other organizations and show that you can do things besides just study and be really good in school. So any other extracurricular activities that you can be involved in is fantastic. Specifically, if you can be a leader in an organization in your school, or if you can participate in summer programs like science adventure camps, anything like that will get you more exposure into the area. All of those things are beneficial.
All right, we'll have time for one last question, and it's going to be your choice because we've got a lot of questions here. So they've been asking about some specific things, so we're going to throw them out, and you pick the one that you find most interesting. We've got holes in hearts. Okay. We've got broken legs in horses. Okay. West Nile, and search and rescue. Okay, so I am not a horse expert, so I'll defer the horse question. West Nile virus is a great example of one of these diseases that can be spread to people and animals. And generally, people and animals get, if they are infected, most people feel crummy for a day or two. Most animals feel crummy for a day or two, and then they shake it off. But potentially, it can be a real problem and get some people and some animals really sick. It can be very difficult to treat and to diagnose. As far as holes in hearts,
we can see, there's a few things that we can see in hearts. One of the most common things in Texas is heartworm disease, where like we mentioned a little bit earlier, the heartworms have built up in your heart, and we can give a medicine that kills those worms, but it's also really, really hard on the animal as well. So it's a disease where an ounce of prevention is worth a pound of cure, and all of your pets should be on year-round heartworm preventative so that is not a problem. There are animals that are born with congenital heart defects. Congenital means born with it. So heart defect meaning a problem with your heart. One of the most common is called a patent foramen ovale, where there is an opening in your heart when you are still in the uterus before you're born. Your lungs don't have to work because you're getting all of your oxygenation from the mother's blood. As soon as you're born, this little hole is supposed to close so that now you have to breathe with your lungs. And sometimes that doesn't happen, and those animals will have exercise intolerance and other problems and require either surgery to close that hole, or we can do a procedure where we take a tiny little plug and we run a small catheter up the animal's veins into its heart and put the plug into the hole.
Fascinating. Thank you so much, Dr. Stickney, for this
welcome.
wonderful program. We are about out of time today. If you'd like to learn more about veterinary science or other STEM topics, please visit our website, peer.tamu.edu, where you will find videos, curriculum, activities, all kinds of things that you can implement in your class, your 4-H group, or even at home. And we hope that you will join us after the Thanksgiving break as we explore as we explore anatomy and physiology. Thank you so much and have a great day.